New tonight at 9, for the very first time, the National Institute of Health held a conference to get more details on using psychedelics for therapy and how insurance might cover that.
Local scientist from UCSF was on that panel. Our KRON 4's Ella Sogomonian spoke with her to learn more about the treatments that she's been working on. Ella, do explain.
Well, Vicki and Grant, this panel discussed drugs that at the moment on the federal level are considered criminal and are not approved for medicinal use. So the neuroscientist that I spoke with hopes that this workshop is a sign that one day that could change. MDMA and psychedelics are often associated with partying, but researchers across America are increasingly curious about how these drugs could be helpful in a medical setting. Although the federal government still classifies these substances as Schedule I, meaning they are not accepted for medical use and funding for studies are not provided, scientists are given permission to conduct clinical trials. Neuroscientist and UCSF professor Dr. Jennifer Mitchell has partnered up with MAPS, a psychedelic research group based in Santa Cruz. With their help, she has used these drugs with willing patients to treat mental health issues like PTSD, depression, and addiction.
It's a little like peeling an onion. Sometimes people come in with a trauma, say a war-related trauma in which they experienced or saw something terrible. But then once that trauma is processed and released, you find that there are other developmental traumas underneath that also need to be processed and released for that person to sort of move on.
Although her work dates back to the early 90s, it was just this month that she was invited by the National Institute of Health to share her findings in a first-of-its-kind panel. Together, they explored potential benefits, going as far as addressing how insurance companies could cover estimated costs.
Super exciting, of course, right? It's 30 years in coming. And my hope is that it will result in lots of new research opportunities.
Dr. Mitchell explains patients are first weaned off of antidepressants, then they're faced with the hard work of delving deep into their trauma. But the psychedelics, paired with the right environment, provide a clearer path to recovery.
It looks a lot like a really comfortable living room, but it's a very safe space. It's a very comfortable space, and the participant is attended by two very well-trained therapists the entire time that they're in there. It's super fun to watch, actually, because you wouldn't think it would be that compelling, and it really is.
In her recent study, Dr. Mitchell said about 63% of 100 patients no longer met the criteria for PTSD after their sessions were complete. Others had diminished symptoms or disability from depression, and no evidence of addiction was found, which the FDA is tracking. Dr. Mitchell says that she hasn't found any downside to these treatments apart from the time it takes, because psychedelics can take hours before a patient comes down from them, sometimes 8 hours. And we have been reporting on another note that Senator Scott Wiener is one lawmaker here in California that's looking to decriminalize these drugs statewide. Dr. Mitchell wrote him a letter. She's concerned, saying that there needs to be a stronger safety net in place before she believes that that should happen. Live in the newsroom, Ella Sogomonian, KRON 4 News.